Hi and welcome. I'm trying to learn medicine. Today Atheroma, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, that is better at your own risk. And we're talking about diseases and internal anatomy and the blood system. And this is no medical advice, so we're just learning. Atheroma. That is a degeneration of the walls of the arteries. The condition is also known as atherosclerosis and arteriosclerosis. Okay, atheroma. The walls of the arteries are degenerating. I don't know what it really means, but it's not good if they degenerate. Fatty deposits develop on the artery walls, which then harden, producing a condition known as sclerosis. Okay, at the walls of the arteries, their fat seems to be stored or lying around, and that condition is known as sclerosis. Now, once we were talking about sclerosis, maybe sclerosis is something completely different than multiple sclerosis or lateral sclerosis or something else. The other thing, we had the word precipitation somewhere. Anxiety or excitement seems to precipitate attacks in some people to asthma. Now, precipitation is also used, did I remember, in the weather and meteorology to say that is when the snow and the rainfall all combine. The other words, I don't know what it means. Precipitate. Okay, sclerosis. The deposits enlarge into plaques, raised circular areas, which together with the sclerosis lead to narrowing of the artery. Okay, atheroma, the pipe gets smaller because there's a lot of dirt lying around, fatty deposits, and then over time, do they get larger as raised circular areas and they are in plaque. Atrial thrombosis, clotting of the blood, may occur at any site where plaque occurs. Okay, at the places where plaque had occurred, where arterial thrombosis can happen. And that is when a clotting of the blood gets sticky. It gets to one part, it doesn't flow anymore. Atheroma begins in early adult life and increases with age. It affects almost everybody in the West to some degree, and with thrombosis, its chief complication. It is the main cause of heart diseases and strokes. What was known as stroke? The stroke was the thing in the brain, I think. It affects almost everybody, so almost everybody has it to some degree and gets stronger over time. Atheroma causes no symptoms until it reaches the stage when the narrowing of an artery interferes with the circulation of the blood. Okay, there are no symptoms, so people don't notice it, they don't get an early warning, and then it happens. It interferes with the circulation of the blood. Then any of the following symptoms may occur depending on the part of the body that is affected. Symptoms caused by narrowing of the artery when the heart is affected are chest pain on exertion, which is relieved by rest. That is when angina. So angina can be caused through atheroma, but also for other things. It can also be when the brain is affected, temporal disturbances of balance, vision, speech, and use of arms and legs. And atheroma can disturb the head, but just through the blood supply. Not for anything else, I think. That's my guess, my open thinking guess, my open forward guess. See transient ischemic attacks and intermittent claudication. And when the legs are affected, then this. Pain in the calves when walking, which is relieved by rest. See intermittent claudication. Okay, when the heart is affected by the atheroma, so fatty deposits at the walls of the heart, and then at these places plaque can form and it gets more and more narrowed, and at these places where the plaque is when blood clots can form, thrombosis, and the whole thing gets narrower and it doesn't work anymore, and that's a problem. I think what we mean is, let's speculate a little bit. It is not that the at some time it's completely closed, but it is that it gets closer and there are no places. Basically, the blood can't flow properly through it, and it gets stuck, and there happens a traffic jam. And always the blood is standing there around, and because it's not moving anymore, it gets firm, it grows roots, and the blood then gets sticky because it doesn't travel anymore. And then one day this sticky mass gets firmer, and then suddenly maybe it rips off, and then that's the front, and that can get stuck. So what I want to say with is that I think so far that Atheroma is not that the after gets completely closed, but that it gets more slower at the place, like a needle. Just I don't know if that saying exists in English. It gets closer and closer, and then whatever. But it's not so important right now. I think there exist maybe even both versions. Maybe I explained now differently. Okay, but the first one is that if the heart is affected, then there can be angina, chest pain on exertion, which get better by resting. When the brain is affected, then there can be balance, vision, speech, use of arms and legs, problematic. And also when the legs are affected, yes, so that would mean something else. If the legs are affected with intermittent claudication and there gets pain in the calves when walking, then it would be not that there would be a thromb going suddenly on and gets stuck and completely closes something. Then it would be just that actually less blood travels to the legs, because this intermittent claudication just gets worse when you walk and do exercises. So then in that cases, this is not that something rips off or every thrombosis happens, it's just that it's actually narrowed. Whatever. Pretty sure both versions exist. Symptoms caused by blocking of the artery. No. We're having a bit more. That means we're going to make a split here. We're going to continue in the second part. Now, if you are here for medicine, then you can directly to the next part. If you are here for short engagement training and you participate in the short engagement training, then it's better at your own risk. We are doing shoulder circuits. We are going back, up, and front, and down. And again, back, up, and front, and down. And backwards. One more round. And now, long arms, down, yes, long arms, strong fist, and we're going as far back as we can with the shoulders. No higher up, and in front, just down, back, up, and in front, and down, and now backwards. Up, back, down, front, up, back, and down. Now, legs wide apart, we go into the knees, ranging forward with a straight back. Let the arms hang and pinch the shoulders together. Do it with effort. Now make strong fists. Lift the arms up and still pinch the scapulars together. Release. And a second time. Pinch the scapulars together with effort. Making fists. Lift the arms up and still pinch the scapulars together. And release. And a similar exercise into the knees, hinge forward, fish on back, let the arms hang, make fists, turn the arms to the inside, lift the arms high up and bring the fists together. Straighten up, bring the shoulders down, together. Now the arms high up and together, shoulders down, together. And a second time. Into the knees, hinge forward with the round back, let the arms hang, make fists to the inside, lift the arms high up, bring them together. Straighten up, shoulders down, together. release. And now we lifting the arms up. We're not doing anything in particular, just lift the arms up. If this exercise causes pain, then don't do it. Again, the arms up, just to relax, and also to observe what the scapulars are doing. The scapulars should go back and open up so that the humerus, the bone in the upper arm, can just come up. And now the arms to the side, and again just observe what the scapulars are doing. The scapula should go now back together, and now a bit to the outside of the ribcage. And back together, and into the direction of the outsides of the ribcage. And the last time. And now we're doing the third lifter. Again, long arms, strong fists, shoulders down, head together, and now turn the arms to the inside. Now the arms to the outside, shoulders down, head together. Arms to the inside, shoulders down, head together. And the arms to the outside the last time, shoulders down, head together. And release. Now the arms to the outside, a bit in front. Bring the arms at front, so the pronation, and the shoulders down, together. And change. Arms back, shoulders up, and a front. And change. Arms in front, shoulders back, together. And change. Arms back, shoulders up, and in front. And release. Now shrug. Lift again the arms up. Shrug, shoulders up. And release it all down. Again the arms up. Shoulders up. All down. Again the arms up. Shoulders up. And all down. Now press the cord, arms together, a bit down and to the outside. Again, just to relax, but also to observe what the scapulars are doing. And the last round. Now with that leg. You can also use something else. Have it with a long arm at the outside, or let it fall down, and try to catch it again. And on the other side. And now, stretching. I bring one arm in front, shoulders back and down. Pull the arm in, have flat fingers, try to relax the arm. Go a bit back with the shoulder, and turn the palm a bit up to the sky. And the arm in front, shoulders back, down, pull the arm in, have flat fingers, try to relax the arm, go a bit back with the shoulder, turn the palm up to the sky a bit. And release. That was the shoulder tension training. I thank you very much, and until next time.